Friends of ours from Broadlawns Medical Center, and we've learned some things about Broadlawns that have really surprised a lot of people.
It's an amazing place to go check out if you haven't, because anyone off the street can go check out the amazing services they provide. And
some major services too that you might be surprised to hear about. And here is something that a lot of people talk about on a regular basis: your feet.
Your feet.
Yeah, so we have three foot doctors, to put it in layman's terms, that are visiting with us right now. We do have with us, joining us on over on the stools there, Dr. Ben Olson is here from Broadlawns Medical Center, Dr. Micah Murdoch, and also Dr. Ron Balin. And you guys brought some samples with us, some props, so to speak. But tell everybody a little bit about what they can expect if they are having any kind of foot or ankle problems, and Broadlawns Medical Center.
Yeah, I'll go ahead and start. I don't have any props, so I'll start. Yeah, we have a good crew over there at Broadlawns. Our staff is very professional. They're hardworking. What we provide, Dr. Murdoch, Dr. Olson, and myself, we provide care for anything from below the knee. That would include any kind of sports medicine, any kind of fractures, any kind of ulcers, bunions, hammer toes, any kind of diabetic foot care. Again, we do anything. We do reconstruction. Dr. Olson's going to talk about that. Dr. Murdoch's going to talk about total ankle replacements that we do over there. On a quick note, 60% of diabetics go into some kind of amputation, so you definitely want to get your feet checked. You can do that at Broadlawns 282 Foot, which is 282-3668. And our staff, like I said, they're great. They'll hopefully get you in that day or hopefully the next day. So, yep, there we go.
So basically, you cover every single part of what you said, below the knee. If there's something going on with whether it's health issues, outside on the skin, inside with the bone, you guys are dealing with it.
Correct, yes.
Now, Dr. Balin, I'm glad you mentioned about diabetes and about foot problems and amputations and things like that. Just this morning, I'm not making this up, just saw a little informational piece about people that might have diabetes and might be experiencing foot pain, but they don't say anything to their doctor. They think they can deal with it. Do you run across that very often? We do. They need to be it's really good to have your primary care physician following along with your diabetes. We get a lot of referrals from primary care physicians to take care of the lower extremity difficulties they have with diabetes. Yes, patients have to take care of their diabetes. The more they take care of their diabetes or blood sugar, the better it is for their feet. Again, they can avoid amputations. Just better overall for the lower extremities to take care of their diabetes.
Now, the different props you guys brought in today, kind of to explain what you're showing us here.
So the one I brought today is actually a total ankle replacement. It's one of the unique services that we provide at Broadlawns that is not provided everywhere else here in town. And so what this is for people who have degenerative joint disease of their ankle or arthritis of their ankle or some type of process that's causing them to have pain and limited motion in their ankle. This prosthesis essentially goes in just like you would a total knee or a total hip, and it replaces the ankle joint and allows them to have good motion and prevent having to have a fusion of the ankle joint in the future, and allows them to keep and maintain their motion in their active lifestyle.
All right, now here we go. What's the warranty on a part like this?
So, you know, they're expected to last a long time, and a lot of it depends on how much you use it. So if you're really hard on your total ankle joint and you do a lot of activities, it's probably not going to last you longer than 15 years, and you might have to replace the piece in the middle. If you're not too hard on it, it should last you quite a while and get you through, and hopefully not have to have a repeat.
Say if you're a runner, say if you jog on a regular basis, can you do that, or is that not recommended?
So one of the things that all of the companies recommend is that you do not do high impact exercises on your total ankle replacement, because the polyurethane in the middle can break.
Got it.
And so you can do hiking, biking, swimming, walking, all that kind of stuff, but they ask you not to do any running or anything with sharp cutting and anything like that.
That makes sense.
But it's still amazing
that
how your ankle can still move completely freely like that.
This is more things. It's amazing, and you're doing this at Broadlawns, right?
That's correct, yeah.
That is awesome.
Now, I know ankle boots are the hot thing right now, but I don't know if I would enjoy having that one around my foot. What do you have there?
This is pretty much our adult erector set. It's an external circular frame where we don't use these every day, but it's one of those things that if you need it, it's definitely something we have in store. It's usually maintained for traumatic injuries. And as you were talking about diabetics lose feeling in their feet, so they don't realize that they're walking on an injury. and their bones kind of get washed out or soft. So sometimes we have to use something more like this rather than internal
Really?
plates and screws.
Now, you talk about diabetes and other health conditions. Can you make diagnoses of further health problems by looking at someone's feet? By looking at some of the symptoms that they see, are you able to determine if somebody has other issues that are perhaps causing that?
A lot of other health problems do manifest in the foot first. So
Really?
there are plenty of instances like that we'll see issues with the foot that are more serious health concerns throughout the body, yeah.
For example, what would you say?
I mean, diabetes is the big one.
Right.
But there's other arthritides, rheumatoid arthritis per se, something like that. Other endocrine issues as well.
So a foot checkup isn't a bad idea.
Yeah.
No, yeah, it's definitely a highly
Because there's a
recommended.
lot of bones in the feet, and I think I'm safe to ask you guys, how many bones can we find in your foot?
Well, pretty much 26 is the standard answer.
That's a lot of bones, yeah.
Is it one of those things you don't think about? You're wearing shoes, you're hard on them, you're wearing them down. They're not always the best thing to look at because you are hard on them. Is that why we don't care about them as much or don't think about them when it comes to taking them for a checkup?
Yeah, a lot of people just take their feet for granted.
There you go. All right, but don't take them for granted, and don't take for granted all the amazing things they do over at Broadlawns. Ron, let us know again the number we need to call if we want more information.
Sure, it's Broadlawns Foot and Ankle Clinic, and it's also the number to the wound clinic. It's 282-FOOT, which is 282-3668.
It doesn't get any easier than that.
That's easy.
Everybody's
it
going to
down.
remember that. That's a piece of cake. But again,
Perfect.
Broadlawns, some amazing, some surprising things available at Broadlawns Medical Center. If you haven't checked it out lately, folks, if nothing else, just make a stop over there. Easy to find, right off of MLK over on Hickman. So just stop in and check it out. Broadlawns. Thank you, gentlemen,
Thank
for
you
being
guys
here.
so
We appreciate
much.